Medicaid is a federal program that provides free or low-cost health insurance coverage. In all states, Medicaid is available to people with a low income, low resources, and meet a specific category of eligibility. Those categories are different in each state, but usually include children, pregnant women, seniors, and people with disabilities, including someone with cancer. Resources are things like money in a bank account or retirement account, like a 401k plan. Since 2014, 39 states have expanded Medicaid to people with a household income under 138% of the federal poverty level. In these states, Medicaid will only look at your income to see if you qualify for this program, not your resources. Because Medicaid is run by state governments, it may be called by a different name in your state. For example, in Wisconsin, Medicaid is called Badger Care, and in California, it is called Medi-Cal. In every state, Medicaid covers medical care that you receive in a hospital or outside of a hospital, like going to visit your doctor. It also covers things like blood tests, X-rays, and scans. It covers care when you are pregnant, as well as mental health care. Medicaid also pays for long-term care services. Medicaid must also cover routine costs when you participate in a clinical trial. States may decide to cover other services, such as dental care. There are two types of Medicaid plans: fee-for-service plans and managed care plans. Fee-for-service plans allow you to see any healthcare provider who accepts Medicaid. Managed care plans require you to use a specific set of healthcare providers who are in the plan's network. Depending on the state and county that you live in, you may have access to fee-for-service plans, managed care plans, or both. What you pay each month for Medicaid also depends on the state that you live in and how you qualify for Medicaid. You may also have to pay certain costs out of pocket. For example, a copayment is a fixed dollar amount that you have to pay when you get certain types of medical care. So, if you need a prescription drug, you may have to pay a copayment at the pharmacy. You can apply for Medicaid at any time. You can typically apply online at healthcare.gov or through your state Medicaid agency. You can find your state agency at triagecancer.org. Your Medicaid coverage will usually start on the day that you apply or on the first day of the month that you apply. Some states will also go back 3 months before you apply to pay for any medical care that you received. If you stop being eligible for Medicaid, your coverage will usually end at the end of that month. If you are denied Medicaid coverage, you can appeal that decision. There is a specific process and timeline for filing an appeal. There are organizations that can help you file an appeal. If you are over the age of 65, or if you are receiving Social Security Disability Insurance, or SSDI benefits, then you may also be eligible for Medicare. Medicare is another federal health insurance program for seniors and people with disabilities. If you qualify for both programs, Medicaid can help pay for things Medicare doesn't pay for and lowers the costs you have to pay for Medicare. For more information about Medicaid and other health insurance options, visit triagecancer.org or cancerfinances.org.